Good morning, ladies and gentlemen. Before I start, I would like to express my double gratitude, I have to say, to all partners who keep this initiative alive, because I think that it is much more difficult and more challenging to keep such initiatives sustainable than to organize it just once. And now, let me start with briefly 3 milestones in a very short history of digital health literacy. Which one, please? May I ask you for assistance? Oh, this one. Okay, thank you. So, in 2006, Norman and Skinner proposed the concept of e-health literacy using the so-called Lilly model that describes e-health literacy as a meta-literacy combining 6 types of literacies. In 2022, a conceptual framework of e-health literacy in older adults was for the first time developed based on analysis of 28 studies. And as we can see within this framework, attributes, antecedents, and consequences were identified. One of the latest scoping review, which included research articles printed in English and China Sea and published between 2014 and 2023, further aimed at exploring the influencing factors, revealed that the digital health literacy of older adults is affected by sociodemographic factors like age or gender, digital device-related factors, and social support factors. So nowadays, we can see digital literacy as an expansion of the concept of e-health literacy, viewing a health literacy as a key attribute of digital health literacy rather than interchangeable term. Move to Slovakia now. Thanks to our participation in the InHeal project in the past, we also did desktop research on digital health literacy of older adults, and we found that it is a new area of public health research with very limited data on older adults. As we can see, also some data were available. The participants aged over 65 usually represented only small subsamples. These findings inspired us to apply for a national research grant and strengthen digital health literacy of older adults in Slovakia through data collection, as well as through designing some pilot interventions. And today I would like to mention our preliminary findings on associations between sociodemographic characteristics, self-related health, and digital health literacy among older adults in Slovakia. Our cross-sectional study included 184 adults aged 55 years and older, and yesterday we received the questions about the selection of the sample, and one of the reasons why we decided to include not only 65 plus population was also the fact that life expectancy of Slovak population unfortunately still remains among the lowest in the European Union countries. So as we can see, most of our sample were females, were aged 65 to 69, had secondary education, and were living with a spouse. Social status was measured using MacArthur Subjective Social Status Scale, and the mean age in our sample was 6.5. Self-rated health was assessed using a question from the SF36 tool, and almost half of respondents perceived their health as good, and 30% perceived their health as fair. We measured digital health literacy using the 8-item e-health literacy scale, which assesses how confident people are in finding, evaluating, and using electronic health information for health decisions. And as we can see, the mean e-health literacy score achieved in our sample was 24.2. That reflects moderate digital health literacy level. But we can also see some comparisons of our findings with other studies using the same measurement tool from other countries worldwide. So as we can see, in some studies or in comparison to some studies, in our sample, the achieved digital health literacy level was higher, or in comparison some others lower. Multiple linear regressions analysis, which we performed, showed us that higher digital literacy was significantly associated with higher education and with better self-rated health. No role of age, sex, employment status, social status or marital status in digital health literacy was found in our sample. The final model explained 15.3% of variance in digital health literacy. I would like to show you for comparison also some data from V4 countries. However, these data are based for another survey, and this survey was done in 2019 and 2021 within the health literacy survey, and the data were collected only from 3 of the 4 countries, so unfortunately Poland didn't participate, and the instrument which was applied was oriented on how easily people access, understand, appraise, and apply digital health information. And as we can see, similar to other countries, a social gradient was found where lower digital health literacy was again associated with lower educational level, older age, and lower social status. So our preliminary findings suggest that for reducing the digital health literacy gaps in older adults, tailoring the interventions to individuals with lower educational level could be beneficial. The study further indicates that poor general health may significantly limit older adults' ability to improve their digital health literacy. However, given the fact that age doesn't always appear as a significant predictor, incorporating intergenerational approach may provide an additional mechanisms for mitigating disparities in digital health literacy of older adults. Let us hope that in the digitalization era, also the Engaging project is one of the platforms that will not leave older adults behind. Enjoy the rest of Engaging conference, and thank you for your attention.